Hi, I'm Dr. Eli Whitney, a cardiologist at the Heart and Vascular Institute of Texas. I'm here to talk about clopidogrel, also known as Plavix. As you know, cardiovascular diseases, including heart attacks and strokes, are the #1 cause of death in our country. Most heart attacks and strokes are caused by the sudden formation of a blood clot in the arteries feeding the brain or heart at the site of a cholesterol deposit. The blood clot totally stops the flow of blood, and this leads to the death of the heart muscle or brain tissue fed by the blocked artery. Platelets are small, microscopic particles in the blood that prevent us from excessive bleeding whenever we are cut or injured. Most blood clots are started when platelets become activated and group together in the wall of an artery. When the platelets are activated and grouped together, they release certain chemicals that cause the liquid part of the blood to thicken into a jelly-like material called fibrin. A blood clot is made of the platelets that have grouped together, fibrin, and other red blood cells. By preventing the initial activation and grouping of platelets, we can thin the blood and prevent heart attacks and strokes. For the past 15 years, aspirin has been recommended for most patients who have had a heart attack or a stroke. Aspirin works by blocking one of the 3 major ways to activate platelets. In many clinical studies, aspirin has been shown to reduce the risk of having a heart attack or stroke by 20 to 30%. There are 2 other ways that platelets can become activated that are not prevented by aspirin. Clopidogrel, also known as Plavix, is a medication which can block one of the other ways to activate platelets. Several years ago, in the CURE study, medical scientists took over 12,000 patients who presented to emergency rooms with pain suggesting that they were either having a heart attack or were about to have a heart attack. They split these patients into 2 groups. One group received 1 adult aspirin per day, while the other group received clopidogrel or Plavix and 1 adult aspirin. The patients were followed for an average of 9 months. This slide shows the difference in the 2 groups compared with time. As you can see, the major difference between the 2 groups occurs in the first 4 to 5 months of therapy with clopidogrel. The difference then slowly increases thereafter. Overall, the group that received aspirin and clopidogrel were 20% less likely to have a stroke, heart attack, or die from cardiovascular disease than the group that received aspirin alone. For these reasons, many physicians are recommending that patients take clopidogrel for several months after a heart attack, balloon treatment, and particularly when stents are used with the balloon therapy. The risk of significant bleeding was 2.7% in the group that received aspirin alone, compared with 3.6% in the group who received clopidogrel and aspirin. Hence, there was a small increase in the risk of bleeding. Diabetics and patients who have peripheral vascular disease are at much greater risk to develop heart attacks and strokes compared with patients without diabetes or peripheral vascular disease. Part of the reason for this increase in risk is that the platelets of diabetic patients and patients with peripheral vascular disease are very sticky compared with people without diabetes or peripheral vascular disease. The stickiest platelets are platelets that are physically large. For this reason, some cardiologists believe that diabetics and patients with peripheral vascular disease who have large platelets should be placed routinely on clopidogrel in addition to aspirin, even if they are doing well. The size of the platelets can be determined easily with a routine blood test in any physician's office. If you are on clopidogrel in addition to aspirin to help you thin your blood, and you are advised to have any type of surgery, it may be wise to stop the clopidogrel in addition to the aspirin for 1 week prior to your surgery. Please consult with your doctor about this prior to any invasive medical procedure. I hope this educational program has helped you understand why I may be doing some additional blood tests on you and why I may be putting you on another medication to thin your blood. I'm Dr. Eli Whitney with the Heart and Vascular Institute of Texas.